I want to show you what we do here at Avery Hall to help people find their prescription plans. And so medicare.gov is the official website for Medicare. And so this is what we use to determine which plan is the best option for our clients. This is not a website that is special for agents. It is a public website for anyone to use. And so you would go to medicare.gov. You would click on right here, find plans, find health and drug plans. And if you have an account through Medicare, this is where you can log into your medicare.gov account. And if you do this, if you log in or you create your account and you plug in your prescriptions will actually save on your account. So you can look up your prescription plan all throughout the year. And so it is beneficial for you to have a MyMedicare.gov account. But I don't know people's login information. It's not what we help people with. But so I would click here where it says continue without logging in. If you are looking to create an account, you would just log in or create an account right here. And so continue without logging in. And so for today's purposes, we're just going to look up a drug plan, which is Part D. You enter your zip code. I have a lot of zip codes saved. And so I'm going to use Salisbury's, Maryland zip code 21801. And then you have to select your county. Luckily, we have one county in that zip code, so it's easy for us. But there are several zip codes that have a couple of county choices. So you would have to make sure you choose the county that is your county. And so here it says, do you get help from one of these programs, which is help with like the cost of your medications or the cost of your prescription plan? I assume that people don't get any help unless someone tells me that they get help. And typically, if you are getting extra help or you're on Medicaid, I know about that prior to meeting with a client because they make that very clear to me. And so you click, I don't get any help from any of these programs. And if you're not sure, click I'm not sure. And so the next page asks, do you want to see the cost of your medications when you're comparing your plan? So we're going to say yes. We want to see the cost of our medications because that's what the point of trying to find the best plan is. And so this is where you start entering your prescriptions. And so the way the medicare.gov system works is that you can enter just a few letters of your medication. Let's say you don't know how to spell it, which is very common. You can enter just a few letters of your medication. So I'm just going to do some very common medications, and I'm going to start with lisinopril. That is a blood pressure medication. It's a very common medication that people are on. This drop-down list asks you what dosage are you taking? Are you taking 5 milligrams? Are you taking 20 milligrams? For this purpose today, we're going to use 40 milligrams. And then this next quantity section here asks, how many pills do you take a month? And so we're going to use 30. Typically with prescription plans, it's not 31, it would always be 30. And some people like to change the frequency. Let's say they only get this medication once a year. And so like a lot of skin creams, a lot of eye drops are only once a year type of prescription. So this is where you would change that at. I always show clients a monthly charge because most prescription plans, if you do a 90-day supply, the co-payments or the prices are just ×3. And so for purposes of trying to help explain prescription plans, I always choose monthly because I think it's a little bit easier to explain. And I'm just going to keep adding a couple prescriptions just so you can see how it works. Again, frequency, we're going to choose every month. I'm going to add one brand name drug that is a very common drug that people take is Synthroid, just so you can see how that's covered. So let's say you enter a brand name drug that you're on and it pops up and it says, hey, a generic's available. Do you want to use the lower cost generic? And so most people take the lower cost generic of Synthroid, which is levothyroxine, but there are people that do use the brand. For today, we're going to use the generic. And so under levothyroxine, though, there are capsules and tablets. And so you want to make sure that if this is your prescription, that you're picking the appropriate milligrams or micrograms and appropriate type of pill, whether it's a capsule or a tablet. Most people are using the tablet. Typically, if they're using the capsule, that means they're allergic to something, one of the ingredients that are used to make the tablet. I think that's enough prescriptions. There's all 4 generics, so we're going to get a very low-cost prescription plan. But this is just enough for us for purposes today to help understand how it works. So once you've added all of your drugs, you would go all the way down to the bottom of the page and click Done Adding Drugs. And then you would choose your pharmacy. You can use this tool here to type in your pharmacy, or you can look down and change the distance, the filter. You can change the distance so you could find your pharmacy. I think it's just as easy to type in your pharmacy. So for today, I want to see what mail order costs and what Walgreens costs. And then at the bottom right-hand screen, you're going to click Done. And so now we're at all of the prescription plans that exist in Maryland in the zip code of 21801. I said there was only 20 or 21 plans, but there's actually 27 plans. That's where you can see that right there. And so I sort all of the plans by the lowest drug plus premium cost. And so this is how we help navigate this system and help recommend plans for people, like the prescription plans anyways. So the first plan that comes up is a WellCare Value Script plan. The premium for WellCare for 2021 is $16.20. And this is what I look at to help try to determine, what plan's best is what is the total yearly drug cost and premium cost. Now, when you do this, it's assuming the rest of the year. It's not necessarily a 12-month window. So this particular plan would be the plan that we would look at for our client, because this is a great plan. The WellCare plan is. I have a lot of clients that are on this plan. And so you would click Plan Details. So you can see under this particular plan, the total monthly premium, again, is $16.20. The drug deductible is $445. And if you scroll down, you're going to be able to see a list of your medications at Walgreens and what you will pay for them. Luckily, the 4 medications I picked to add to this, all 4 of these medications are actually covered 100%. And so under cost before deductible, this tells you whether or not your prescriptions go towards your deductible or not. And so as you can see, the cost before deductible is 0 for all 4 of these medications. So that tells me as an agent that this client does not have to pay their deductible for the 4 medications that they're on. If for some reason there was a number in this cost before deductible, whether, like let's say it's the $14.49 for levothyroxine, that would tell me that levothyroxine is going towards the Medicare Part D deductible, which is that $445. Another place to look is if you do mail order, your drugs are covered 100% as well. And then lastly, you look all the way down at other drug information. And so you see that all 4 of your prescriptions are tier 1, so that's why they're covered 100%. The last thing I'm going to show you is if you scroll all the way up under this tiered drug cost. And so this is a drop down as well. So if you wanted to see what the copays would be for other prescriptions, this is where you would see it. 25% is a very common percentage for specialty tiers, and that's pretty much amongst all prescription drug plans. That's the standard that Medicare created, but because of the cost of specialty prescriptions, not many prescription plans, I don't think there's any prescription plans that will offer it less than 25%, but every once in a while we'll see a plan come in where they'll offer them at like 19 or 20%. But pretty commonly, your specialty prescriptions, you're going to pay 25% of in that initial coverage level. Remember that. And it does go over the different stages of coverage. The gap coverage, you're going to pay 25% of all of your medications. Then the catastrophic phase, it shows you that you're going to pay either $3 or 5%, whichever is more. And then the same with brand name drugs. You're either going to pay $9 or 5%, whichever is more. So typically you're paying 5% because brand name drugs cost more money. So hopefully that has helped you guys today. So if you ever want to enroll in a plan on your own, you can do that through medicare.gov. Please keep in mind that what we do here at Avery Hall is free for our services are free to people, so we can help people enroll into these plans. Now, we also don't sell all of the plans, and so it'll be limited on what we can help you with, but we can always recommend what is the best option for you. So hopefully today that has helped you understand how a Medicare prescription drug plan works, and if you do have any questions, please don't hesitate to reach out to us. Thanks for joining in today and learning more about Medicare. If you'd like, click more of my videos and we can learn about Medicare together.